My name is Corey Langer. I'm the Director of Thoracic Oncology at the Abramson Cancer Center, University of Pennsylvania, and I'll be speaking specifically on the influence of comorbidities in the management of squamous cell carcinoma of the lung. In advanced disease, it's only in the last 5 to 10 years that we've realized that squamous cell patients have inferior prognosis compared to adenocarcinoma. I think this is threefold. Number one, the natural biology of the disease seems to be different. Number two, we have fewer therapeutic options which are available to advanced disease patients with adenocarcinoma are contraindicated in squamous cells. So the therapeutic improvements that have been seen with these agents are really denied to those patients. But also comorbidity, cardiac disease, pulmonary disease, other chronic illnesses that smokers develop make it that much more difficult to deliver chemotherapy adequately. Individuals with squamous cell carcinoma of the lung are more likely to be older. They're more likely to have been either past or current smokers, and as a consequence will often have the comorbidities that are brought on by a history of cigarette smoking. So they're more likely to have cardiopulmonary disease, particularly emphysema, heart disease, coronary disease, and this poses a particular challenge when we're managing these patients. Just as an example, an individual who smoked heavily who has emphysema will have compromised pulmonary function, and to adequately deliver concurrent chemoradiation, you need to satisfy certain parameters. And these patients, those with chronic pulmonary disease, are more likely to have unsatisfactory parameters. And so delivering radiation properly at full dose without an interruption becomes that much more difficult. And so these individuals, because of comorbidities, often need to get sequential treatment, asynchronous chemotherapy and radiation rather than concurrent therapy. And we know that that approach, although it's certainly better than radiation alone, is inferior to concurrent chemoradiation. Without question, the cumulative impact of comorbidities in smokers, particularly in those with squamous cell carcinoma, make it much more challenging to properly treat these patients.